Hello, I'm Dr. Mira Bihari, a pediatrician and adolescent medicine specialist, here with the video of the week for the week of April 8th, the Great American Eclipse. Today, we are continuing on with our series on what to do when. For those of you who've been following along, thank you for following along. If this is your first time watching, you may want to check out some of the other videos from before. Today, we're going to answer some of the questions that came in about eating disorders and what to do in your practice to help screen for some patients who might have an eating disorder. So that's our focus today, eating disorder screening questions. And let's dive right in. As a reminder, these videos are for informational and educational purposes only. They are not intended to be a substitute for your own clinical judgment, nor should they be considered a medical consult. If you do need a medical consult or have more specific questions, by all means, reach out to us directly at www.adolescentmedicineconsulting.com or Dr. Bihari at adolescentmedicineconsulting.com with more questions. So I first want us to think about what is a screening test and what makes a good screening test. So first and foremost, we want something that's inexpensive, something that will not break the bank to administer and is easy to administer, something that you can easily incorporate into your workflow that is already humming along. You want it to bring minimal discomfort, that is minimal discomfort to the patient, of course, but also to you as the provider and your team for scoring it and assessing it and figuring out what to do next. You also want something that is reliable and valid. We don't want to be using a test that sometimes gives us an accurate screening answer and positive diagnosis and sometimes doesn't, or sometimes makes something look like a false positive. And we want it to be valid. So consistent, reliable, and also valid at helping us get the diagnosis that we need to get and moving on to next steps. So when we're thinking about a screening test for patients with an eating disorder, we have a few options, especially for the adolescent population. The key thing is to think about what is your current screener. Maybe the tool that you're currently using already includes some of the information that you want that can help you make a decision about if this patient meets criteria for an eating disorder or not. The other ones we're going to talk about today are the ESP and the SCOFF. These are quick, easy to administer in your office, and pretty reliable. So I like people to think about your current screeners, and the key one is the growth chart. We're in primary care, right? So we already have access to the growth chart. We are already looking at the growth chart. If we start seeing some fluctuations up or down in weight and or height, it's a clue that something is going on. So we want to make sure that we're looking at that ahead of time for our patients as they come in the office, if not during the visit, and delve in when we see some changes in those areas. Is it a physical problem like a thyroid disorder, or is it something like an eating disorder or other mental health concern? A lot of us are using the Bright Futures guidelines, and the Bright Futures guidelines include some questions that you can ask during your visit as part of the health screening. We know there are a lot of questions to ask, and there's only so much time in a pediatric visit, but pick one or two of those questions that really resonates with you, make it your own, and use that consistently. Try it out, tweak it if needed. If this is something you want to delve into a little bit more in terms of how you can talk to teens in a way that gets you some valid answers and some open answers from the teen, by all means feel free to reach out to me directly or join one of our free monthly Zoom sessions. I personally like the whole child assessment for a screening tool because it incorporates a lot of the questions about adverse childhood experiences in addition to the routine questions we ask about health. Are these questions specifically intended to diagnose an eating disorder? No. But I think if you have the context of some eating behaviors that are not what we recommend for young people, and some adverse childhood experiences, that is certainly something that makes me a bit more concerned about that patient than somebody who doesn't have those risk factors. Many of you may also be using the RAPS, the Rapid Assessment of Adolescent Preventive Services. This is a tool that I think is really great and popular. I get no kickbacks from the great people at Possibilities for Change and the RAPS folks, but I think the advantage of this tool is that they are updating it pretty much all the time. It is something that you can administer either electronically or in paper and pencil form. And if you're using the electronic version, you get data reports, and it also automatically generates recommendations based on the patient's answers, helps you decide what to do next. I would love to hear from you what tool you are currently using so I can know what's out there and what are some of the challenges, barriers, and what do you need to tweak to help get that information from your adolescents a little bit more. So by all means, leave me a message in the comments or shoot me a message directly, Dr. B. Harry at adolescentmedicineconsulting.com, so we can know a little bit more about what tools you're using and how we can help make sure you identify and assist any patients with eating issues in your practice. Before we delve into the ESP, the Eating Disorder Screen for Primary Care, I do want to put a little asterisk next to using the growth charts for looking at and identifying patients who might have an eating disorder. A lot of patients are not having any fluctuations or changes in their weight. So it's really behaviors over BMI. One of the things that I like to say, we really want to delve into what is the patient doing with food? How are they eating? What is their relationship with food? So the ESP and the SCOFF get into some of that. ESP, 3 or more positive answers are what we would consider needing extra evaluation and referral to higher level of care, or further evaluation either by an adolescent medicine physician like myself or to a program specifically for treatment of patients with eating disorders. First question, are you satisfied with your eating patterns? Bit formal. Tweak that a little bit to make it sound a little bit more up to date and relevant for your patient population. A no answer to that, if someone's not satisfied with their eating patterns or their eating habits, would be considered a positive answer. For the next 4 questions, if they answer yes, then that is considered a positive answer. Do you ever eat in secret? Does your weight affect the way you feel about yourself? Have any members of your family suffered with an eating disorder? Do you currently suffer with, or have you ever suffered with an eating disorder in the past? Some of these questions you're going to get the answer to in your past medical history and family history. And certainly this is something that if you have those positive answers, you don't need to re-ask it in the room. However, if you have a negative answer, it might be worth asking again in the room because sometimes people don't want to put down that positive in something like the family history or whatever forms they're filling out for you, or they might have forgotten, or they just didn't feel comfortable answering that on such a form. So I always say if you have a positive answer, great, you've already gotten your yes positive response for that. But if you don't, you might want to ask it again when you're one-on-one with the patient in the room. Next, we're going to move on to the SCOFF screening tool, so-called the SCOFF because it helps you remember the key questions in this screening tool. Like with the ESP, 3 or more positive answers is considered a positive screening and a reason to refer on for further care. This tool comes from British English, so some of the questions are going to need to be translated into General American. So starting off, do you make yourself sick because you feel uncomfortably full? Or do you make yourself vomit because you feel uncomfortably full? Do you ever worry that you've lost control over how much you eat? Have you recently lost more than 1 stone or 14 pounds in a 3-month period? 1 stone is not a unit of measurement that we typically use here in the States, but this is something that we can certainly track and see on our growth charts for us in pediatrics, and that would be something that we would pay a little bit more attention to. I also did a little deep dive into the history of the stone as a unit of measurement, and I have to say it's fascinating and has been around for a very long time. Let me know if you want to hear the history of it in the future. Do you believe yourself to be fat when others say you are thin? Would you say that food dominates your life? And again, of these 5 questions, 3 or more would be considered positive for having a higher risk of having an eating disorder, and you'd want to move on to more diagnostic tests at that point. In the interest of making sure we use your time wisely and efficiently, I will not delve into diagnostic tools at this time. This is something I am more than happy to discuss in our next free monthly Zoom session. The next one will be this week, April 10th. They occur on the second Wednesday of the month, 8 p.m. Eastern Time, 5 p.m. Pacific, and y'all know what time zone you are if you're in between the coasts. These sessions are for healthcare professionals only, so we do ask that you register in advance, 30 minutes of your time, and you can ask anything and everything about adolescent health. These are not recorded. I'm not going to post them or share them anywhere else. It's just information and a discussion about any and all adolescent health issues with the goal in mind of helping you help the teens in your practice. As always, thank you for tuning in, and please continue to follow for other videos and information about adolescent health in general. If you'd like more information on adolescent health issues, or you have an idea for a topic that you want to discuss, by all means reach out to us, leave me a message in the comments, or send us a message through our website, www.adolescentmedicineconsulting.com. If you'd like some CME credit from our colleagues at CMFI, by all means, click on the links and work on some of those reflection credits. Thank you as always for your time and attention. Take care.